Hello, my name is Veerle. I'm a vet in the Southwest. I'm going to talk this afternoon to you about the use of targeted pulse electromagnetic field therapy in veterinary practice. I work in referral rehab practice, but this device can be definitely used in GP practice. This talk is sponsored by Incubate Animal Health. Any questions you have at the end of the talk, please feel free to email and I will try to get you the answer as soon as possible. Targeted pulse electromagnetic field therapy is a non-pharmaceutical anti-inflammatory device. So it does not involve the administering of tablets or capsules or liquid. It's easy to use in practice and more importantly at home. So it's one of the few things that you as a practitioner, as a nurse or as a vet can give to the owner to take home safely with no side effects. It's non-invasive and non-thermal. I have used it myself and often I don't even know that it's on. Some people claim they get kind of a metally taste in their mouth and animals definitely don't dislike it. It's used for pain management, which is osteoarthritis, disc disease, fractures, but also pancreatitis in cats. I really like this device for this, and wounds. It improves wound healing. It reduces swelling and edema in soft tissue. So you could use it in your sport dogs for soft tissue injuries, but also for lymphangitis, hematomas, and anaphylactic reactions even. So for me, it's a kind of perfect itis treatment: dermatitis, osteoarthritis, lymphangitis. If you look at the spectrum of care, you might not have access to a referral vet within the next 24, 48 hours within your practice. So this gives you a kind of stopgap treatment while you're waiting referral, but also your owner's goals, values, and resources might actually make this the only other option you have if they can't afford to go for a referral or they opt for a kind of more conservative or even palliative care treatment. What do you need to know? Well, all atoms in cell produce an electromagnetic field, and almost every single process which is keeping us alive uses electromagnetic field. So every system in our body communicates with other systems using electromagnetic field therapy. It makes sense that we would be quite sensitive to any changes in electromagnetic field activity around us. What is targeted pulse electromagnetic field therapy? It's a signal that delivers a microcurrent to damaged tissue that is designed to trigger the patient's own anti-inflammatory process. So that's the long and short of it. It's 1/1000th of the strength of a mobile phone signal, and it upregulates the body's own production of endogenous nitrous oxide. So calcium binds to calmodulin, which binds to nitrous oxide synthase and leads to nitrous oxide production and vasodilatation. Nitrous oxide also affects the immune system and the nervous system, and it catalyzes with synthase, makes cyclic guanosine monophosphate, which causes a downregulation of inflammatory cytokines and drives the release of growth factor. The response is only seen in the injured tissue, so you do no harm using it on non-damaged tissue. The targeted pulse electromagnetic field therapy increases the expression of heat shock proteins. Heat shock proteins are chaperones that prevent misfolding and aggregation of protein. Targeted pulse magnetic field therapy increases the expression of adenosine receptors, so a reduction of prostaglandin inflammatory cytokines. How is it in targeted pulse electromagnetic field applied? There's different devices on the market, and the differentiation depends on the shape and the strength of the waveform, the pulse width and the frequency, the size and the geometry of the antenna, and the duration of the signal and the frequency of applications. So in model B there, you see that's the patented signal that we use in animals. Model A is what you see in the bone growth stimulator device, a device that was used in the 1970s to support healing of non-union fractures. Targeted versus non-targeted means that with targeted, you modulate specific biological processes. So you'll find that there's very cheap pulse electromagnetic field devices that you can buy online, but they're non-targeted and you have to really wear them up to 12 hours a day to have any effect. The target you only have in this the table that you see there, you have 15 minutes twice a day. It gives actually a greater reduction in pain score than the non-targeted, which you would have to wear 12 hours a day. History, it all is based on Faraday's law. A pulse, the electromagnetic field, will induce an electric field in a conductor. So in the late 1970s, PEMF was used to treat non-union fractures in beagles. And in 1979, the commercial patented signal for animals, as described before, was developed. In 1980s, you were seeing the development of the bone growth stimulator, which is a low frequency PEMF device to help heal non-union fractures. So this means you have to wear it several hours a day, 3 to 9 months, for 3 to 9 months. So not really something that is particularly useful in veterinary practice. In 1998, nitrous oxide was discovered as a signaling molecule. So that's when they discovered how this actually all works. And as so many things, first we know it works and then we discover how it works. In the 1990s, there was the development of smaller PEMF devices, which were used in animal and human medicine, and also more developed for soft tissue. So if you look at the research and wound healing, this is a study where they treated breast reconstruction patients post breast cancer surgery. And they found that there was quite a reduced post-operative pain and inflammation, but also more importantly, a reduction in opioid use following the breast reconstruction surgery. I think in this particular study, they found as well that there was less discharge coming out of the drains in the PEMF group versus the sham group. If you look at some veterinary articles on this, they found that the use of a PEMF device on open wounds for 10 and 15 days after surgery, that there was an enhanced wound epithelialization. So if you would have non-healing or delayed healing, for example, those horrible wounds after road traffic accidents, this would, for example, be a very helpful device to give home with clients. And you can actually use it through bandages. So even though you have a bandage on it, you could use the pulse electromagnetic field therapy on top of the bandage and you will still have an effect on the tissue. Another study, and this is quite a recent study, in 2019, they did a study on post-operative hemilaminectomy. 60 dogs were involved in this. 27 were in the PEMF group, 28 were in the control group. They had hemilaminectomy performed, and they used the same device I use in practice in this study. And they found that after 6 weeks, the dogs receiving PEMF therapy had an improved wound score versus the ones that had the sham group. So if you look at the research in bone healing, we had the bone growth stimulator in the 1970s, where you had to have it on for 12 hours a day for 3 to 6 months consecutive. And this is still being used to this day. And this is a veterinary model. This was a canine tibial osteotomy model. And they found that the group in the PEMF stimulation of 1 hour a day, there was a faster recovery of load bearing, a significant increase in new bone formation, and a higher mechanical strength. So enhanced effect on callus formation and maturation in the bone healing. The research in veterinary pain management, again, if we go back to that 2019 study, what they also found is that the group that had the PEMF loop had a much lower use of pain medication. So they found that in the group that had the sham group, they had 1.8 times more use of pain medication versus the PEMF group. Another study, this time a 2018 study. So what they found is that in this group, again, that there was incision-associated pain post-surgery was lower, but they also found that there was potentially a reduction of spinal cord injury and enhanced proprioceptive placing. And they found that by measuring the glial fibrillary acidic protein, which is a marker for neurological damage. And they found that this was significantly lower in the PEMF group versus the sham group. This is quite a small study though. So the research on osteoarthritis, I thought this was quite an interesting one. This was published in 2012. So 25 dogs were treated with PEMF once a day for 20 sessions, and 15 dogs, the control group, were treated with non-steroidal once daily for 20 days. And they clinical assessed and owner assessed before and after therapy, but also 4 and 12 months later. And what they found is that the PEMF group both groups improved 20 days later, but after 20 days, the treatment was stopped, but the PEMF group maintained some of the improvements 12 months later. So you can see that that's quite significant. If you imagine, if you combine the use of non-steroidal and PEMF, then the benefits are definitely there, and you can combine these two treatment modalities. So this is the model that I use, and you again have the very specific patented diagram of the wavelength and the pulse frequency down there. So it's a circular device with a button and batteries operated. It's a closed unit to maintain the integrity of the signal. And you can also buy a mat. These are a little bit more expensive, but for example, in practice, you could put these in a kennel and would give a whole body treatment. So you can see these animals definitely don't dislike it, and you don't even need to really attach it. So I place it on my cat when she's asleep, and she's often even not aware that she's having treatments, which is rather nice. So there's two forms of device. There's the auto cycle, where every 2 hours it goes on to a 15-minute run, and that's nice if you want. For example, you could bandage this loop into a Robert Jones, and it will automatically cycle every 2 hours until you do the bandage change. Or you can have a manual model, which I prefer to send home with clients. Is you have a button, you push the button, it goes on to a 15-minute treatment, and it automatically switches off. So you can leave the room after 15 minutes, it will automatically switch off, and that will have 150 treatments on there. They come in two sizes, a 20 centimeter diameter and a 10 centimeter diameter. The treatment field with the 20 centimeter diameter is 25 centimeter each way. So you literally, if you hang it mid-abdomen on a dog, you have 25 centimeters in front and 25 centimeters behind. The strength, of course, tapers off towards the end of that. So the 10 centimeter diameter has a 15 centimeter field each side. The lounge, so the mat, you get nose to tail treatment. As discussed earlier, the battery is non-replaceable. It's in a sealed unit, and they do that to maintain the integrity of the signal. So if you fiddle with it and replace the battery, we don't know if the signal hasn't changed and if you're actually not affecting the biological process you want to affect. The only contraindication is you can't use it near pacemakers because it will interfere with the signal. Big pieces of metal will distort the signal, so you would take collars off or any kind of jackets, but you can put it in bedding and in beds, and it will, and when the animal lies on top of it, it will be fine. It can be used over implants because implants are not magnetic and they are also rather small. So I would still use it over implants. And one of my success stories was a dog with an external fixator that was getting recurrent infections and caused quite a lot of bother to the patient. And that was one of the cases where I had real success with a PEMF device. Can we use it in cancer? Well, misery doesn't come on its own. A lot of cancer patients will have still arthritic changes or other issues. I do use it in cancer patients, especially post-surgery, because we know that PEMF devices will normalize blood flow. And we know that in cancer, often there's an abnormal blood flow. Epilepsy patients, I have several epileptic patients. I will not use it around their head not because I'm frightened that it will interfere with their treatment, but if they have an epileptic fit, it will always be the funky device they applied 15 minutes earlier that triggered the epileptic fit. So I will use it, for example, on their lumbosacral area, on their knee, on their hip, on their elbow, but I might not put it just behind their ears. My personal experience, because I work in rehab practice, I'm always on the lookout for the latest thing that I can use. So I started using them about 5 years ago, and I used to import them from the States. My first patient was a German Shepherd, Jasmine, with lumbosacral disease and was suspected of CDRM. And she was quite funny because we gave the loop to the owner to use at home, and the owner said that Jazz would come and tell her when the loop was finished. So she would put the loop on the lumbosacral area and go and make herself a cup of coffee, the owner, and 15 minutes later, Jazz would appear and say, "Yeah, Mum, I'm done." And she said that the owners actually said that the dog would say, "I want my loop," which she would go and nuzzle the loop if she was due her treatment. She passed away, I think, more than a year later of unrelated issues, just old age. But definitely the loop gave her good quality of life, but also it helped the owner mentally because she had 2-3 times a day, she was able to do something for her dog that was different than giving medication. My second patient was a dog with an infected external fixator. She had several courses of antibiotics. They had culture. There was signs of osteomyelitis, and it was a very nasty tarsal injury after a road traffic accident. I rented the owner the loop for a week, and she was using it 4 times a day. And the next week, the wound looked an awful lot better. And after the external fixators were removed, she kept on using it for a month or 2. And that dog has been signed off as, completely signed off. I think we see her once a year to make sure to catch any early arthritic changes in that particular joint. Currently, I use it a lot for foot osteoarthritis, wobbler's disease. I love it for wobbler's disease because a lot of these dogs, they're conservative management, and it allows them to have 4 treatments a day, especially Dobermans, Weimaraners that I have. The owners love it because it means they don't have to drag their dog into the vet to have acupuncture or laser. It reduces the stress levels for the owner and the dog. Conservative management of disc disease, wounds. I've had some brain injuries where I've used it. I've got a dog with a Guillain-Barré syndrome with front limb paralysis, and we did see a significant improvement after using the loop 4 times a day for a few weeks. And again, pancreatic cats or even osteoarthritic cats, I've got a 14-year-old domestic short hair cross who is not too happy about being acupunctured, so I use the loop on her quite a lot. The most important thing for me is that owners feel empowered. They're part of the treatment regime in a more active way. So you have something that they can do on a daily basis, which helps them deal with their anxiety regarding the treatment of their pet and if they're doing the best by their pet. So I used to rent them out and had a daily kind of charge, and they would bring, and I say, you have to bring it back in 7 days because I'll have other clients who want it. And the problem was people didn't bring them back. They wanted to keep them. So almost all rentals have translated in a sale. And then when the battery is empty, they panic and they want another one here and there. So I find it very useful in practice, and it has definitely allowed me to be much more confident about my conservative management approach in cases where I cannot physically acupuncture the dog twice a week or once a week, or get them in to have laser treatment. The UK market, it seems in this country that PEMF devices were actually, until very recently, only used by veterinary physiotherapists and not used in veterinary practice. But I think there's a massive scope of this being something you have on the side in the treatment room for your inpatient, and also an option for clients that want to take their pet home and want to be doing something on a daily basis, long-term, to improve the quality of life and improve the outcomes of their treatments programs. Thank you for listening to this. If you have any questions, please don't hesitate to give me an email, to send me an email, and I will try to get back to you. If I don't have the answer, I will get you in touch with the people who do have the answer to your question. Thank you very much. Have a nice afternoon.